This is Tia Miller here. She's a 49-year-old female. She's married, has 4 children, and is currently sexually active. I'm Allison Young, her nurse that's going to be presenting my teaching plan over HIV and AIDS. This is taking place in the patient's household. Today, I'm going to be going over my pamphlet that I made on HIV and AIDS. The patient stated that she learns best with visuals and hands-on, so I prepared a pamphlet. The goal of this presentation is to improve my patient's understanding on AIDS by teaching my patient about it will increase her awareness. By the end of the presentation, the patient will be able to identify the patho, risk factors, complications, diagnosis, signs and symptoms, and treatment/interventions for AIDS. After completing this teaching session, the patient will be able to discuss diagnostics about HIV/AIDS. I chose this because it's important for the patient to know how AIDS is controlled. 2, they will be able to identify risk factors of AIDS. It's important because the patient should know how they can get AIDS. And 3, they should be able to identify the signs and symptoms and when to get help. And I chose this because it's important for the patient to be able to identify when to get help. Okay, so the patient already has the pamphlet. So the patho. HIV is also called human immunodeficiency virus because it affects your immune system. AIDS is an acquired immunodeficiency syndrome caused by HIV and characterized by generalized dysfunction of the immune system. HIV then develops into AIDS, which is meaning that it's severely damaged. HIV is transmitted through blood, semen, vaginal secretions, and breast milk. It is considered a chronic illness. The patient will always have it. Most people don't usually get symptoms for many years, and there's no cure, but medications can help. Some complications are neoplasms, which are abnormal or excessive growth. Protozoonum infections, which are infections caused by protozoan. Functional infections, which is any disease caused by fungus. Viral infections, which is proliferation of a harmful virus. Bacterial infections, a disease caused by microorganisms that invade tissues. They can also develop secondary cancers, such as the Kaporsky sarcoma, which is a cancer that causes lesions in the soft tissue. Lymphomas, which is a cancer in the lymphatic system. Cervical cancer, which is a type of cancer that develops in your cervix. Some diagnostics to help identify HIV is the HIV rapid antibody test, which is a positive testing, but then it requires further testing. Enzyme-linked immunosorbent assay, which is ELSA, which is a powerful method for detecting and qualifying a specific protein in the complex mixture. Another is Western blot antibody testing, which is more reliable than the ELSA, but is more time-consuming and more expensive. It is the most common, and it indicates presence of viral antigens. HIV viral load test, if high, it then indicates HIV. Blood test that it is basically a blood test that measures HIV in your blood. A CBC, which is a group of tests that evaluates the cells that circulate in your blood. A CD4 lymphocyte count is an indicator of the immune function in the blood, which just indicates HIV. HIV drug-resistant drug testing, used to help select a drug regimen that will likely be effective in treating your HIV infection. This test is used to determine whether the HIV strand infecting you is resistant or has developed resistance to one or more drugs that are used to treat HIV. Some signs and symptoms. So like I said earlier, the manifestations could take a couple years to even appear. Some are fever, anorexia, weight loss, influenza-like symptoms, lymphadenopathy for at least 3 months, leukemia, diarrhea, fatigue, night sweats, and those are just the basics. So some treatment, which the medication treatments are HAART, which is a highly active antiviral therapy, which is a combination of 3 or more antiviral drugs. One is NRTIs, which are neuroside reverse transcriptia inhibitors. which is an antiviral drug that interferes with the ability of the virus to multiply or reproduce. It treats HIV, and they work by blocking the enzyme. Protease inhibitors are synthetic drugs that inhibit the action of HIV. Protease is an enzyme that cleaves to two prescular proteins into smaller fragments. NNRTIs, they work by sitting in the binding site of the virus structure. Entry inhibitors work by attaching themselves to proteins on the surface of CD4 cells or proteins on the surface of the HIV. HIV integration transfer inhibitor, which is a newer class, they work by blocking HIV replication. Lastly, some interventions are to provide respiratory support, administer oxygen and respiratory treatments as prescribed, provide psychological support and support services as needed, maintain fluid and electrolyte imbalance, monitor for signs and symptoms, and institute positive isolation standards, prevent the spread of infection, provide comfort as necessary, provide malicious skincare, provide adequate nutritional support as provided. Do you have any questions?
No.